Hey guys, coming to you today from, yes, our kitchen. Why am I in the kitchen? Because I had a really great conversation the other day with somebody about someone they know that's very resistant to any practitioner, medical practitioner, that wants to schedule them out for any length of time. They are adamantly opposed and will not ever schedule more than like one or two sort of trial and error, or try and see what happens visits. And she was asking me, how would I talk to somebody like that? And two things came to mind. Number one is their story that's in their head. We've talked about stories, and we all come with stories, we all have them. And I'm in the kitchen because when we first walked into this kitchen, Molly, my wife, and I, we looked at this thing and said, "You gotta be kidding me. It is so small. Barely two people can squeeze by each other." And we immediately had this story in our heads that this was going to be a very difficult year with a kitchen this small. It's about half or a third the size of our kitchen back home. After a while, maybe 2 weeks, we started getting used to it, and it's really not that bad. Yes, I would love to have a bigger kitchen. Yes, there are some gadgets and things I'd love to have, but we're making it work. The story has changed in our heads. We came here thinking, oh, we're not going to be able to function in this kitchen. People like that come to us oftentimes from having other practitioners sell them promised results that they didn't deliver, maybe long drawn out plans of care. I'll pick on chiropractors because they're kind of notorious for that. Draw out these long plans of care and they don't really get any better, or they're just not getting what they feel like they should be, or what they have paid in time and money. So they come to us with these stories in their head, like, you're just going to rip me off just like the next guy. So it's really important to recognize that and flesh it out, shine some light on it. Oh, like we've talked about, like we've scripted. Sounds like you're reluctant, or sounds like you've maybe had a bad experience previously. Great way to start. That automatically just opens them to trusting you a little bit. You're not hiding, you're aware of their concerns. Second thing is expressing to them that we as physical therapists practice evidence-based medicine. So when we are recommending a plan of care, it's got some medical evidence, some research backing it, providing proof that, hey, a certain percent of the population responds in this way by this plan of care. And a lot of that's based on science. It's based on healing time frames and inflammation and nerve and muscle response times. Of course, you guys know that. Show them that that's how they're operating. They're operating from a standpoint of fear and mindset. We know, and looking at how the body reacts to people in those fear states, it will not heal as effectively, as efficiently, and as thoroughly, as quickly as somebody that has a positive mindset or a positive outlook. So this is where our switching getting them out of that fear state and switching them into a positive state, an optimistic state, a state of, again, showing them that bridge from their negative side, negative state storyland to their positive, what's possible storyland. Communicating to them, hey, look, this is where you're at. This is the story that you've created based on your previous experience. Totally understand it, empathize with it, but this is what you need to get past. This is your challenge. You need to, trust me, accept that, hey, we're doing this together. I'm committed to you, to this plan of care. My team is committed. We've got great support people here. We know what we're doing. We've done this before. And there's always a sort of exit clause. If they're not getting better after 2, 3, 4, 5 visits, okay, they can always cancel their visits. There's no full commitment. There's no like, you have to stay in this till the end or else. Those QA forms are a great way to reach out to them and let them know, hey, we're still making sure that you're getting value out of this whole relationship, but you have to commit, or we're asking you to commit to this, series of visits, rather than them steering the boat and just saying, oh, let me just try a couple times and see if I like it or not. So when we let patients come to us and say, oh, I just want to come like once next week, and maybe the following Wednesday, and oh, I'm going to be gone a week, and then I'll try to get in the next Friday or whatever, or they just want to sort of do let me try a couple of visits and see what happens. Number one is you've just put an inexperienced person or a non-expert in the driver's seat. So you've just let them dictate the plan of care when they may not have any experience, knowledge of the situation or their condition. And it's like be like putting somebody that's never sailed a boat at the helm of a cross ocean voyage. I mean, you would never do that. So that's the first problem. The second problem is that it makes it very difficult for you to have any sense of progress or how they're going to how their body's going to respond in a timely way if they're sort of here once this week and then they're not here for a couple of weeks. How do you know how their body's responding? How do you know how to progress them? They're hard to keep track of. If they just sort of cancel a visit or fall off, you don't know what's happened to them. You don't know if they got better from your first visit or worse, or it's very vague and confusing for everybody. There's no clarity, there's no consistency. And so it's very important that we convey confidence. Remind them that we are not salespeople. We at our company, at Asheville Family Fitness, we are not salespeople. We're not pushy. It's not who I am. It's not who the company is. And we will not reflect that. If things are not going well and they're not responding, they're not getting better, they do not have to continue to spend their time and money with us. We will do our best to try to find the best resource for them or the best next step for them. We guide and lead, just like the chain analogy. We don't push a chain, we pull and we guide it and we lead it. We need to be strong and confident about asking them for a commitment as well to this plan of care, so that they can be consistent and so that we know that we can rely on their being part of this relationship and being committed. And just as much as they're asking us for our services, we need to ask them for their commitment. So please give me feedback, questions. I love this dialogue because I am guilty of not really being consistent with this in the past, but we all need to be. And as we get bigger and as there's just more moving parts and we're really trying to implement this team model, we all need to be consistent and we need to be confident and we need to be expressing what we want from the patient as much as they're expressing what they want from us. So I hope that helps, and I'll talk to you guys soon.